Eating an appropriate mix of foods from the food groups and subgroups within an appropriate calorie level is important to promote health at each life stage. Each of the food groups and their subgroups provides an array of nutrients, and the amounts recommended reflect eating patterns that have been associated with positive health outcomes. Food from all of the food groups should be eaten in nutrient dense forms. Healthy dietary patterns include a variety of vegetables from all five vegetables subgroup: dark greens, red and orange, beans, peas and lentils, starchy and others. These include all fresh, frozen, canned and dried options in cooked or raw forms, including 100% vegetable juices. Vegetables in their nutrient-dense forms have limited additions such as salt butter or creamy sauces. Almost 9% of the population does not meet the recommendations for vegetables, does not meet intake recommendation for any of the vegetable subgroup. About 45% of all vegetables are eaten as a separate food item, about 40% as part of a mixed dish, and the remainder are mostly consumed as snack foods and condiments. Vegetables, when consumed on their own, are generally consumed in forms with additional sodium, either from salt added in cooking or added sauces such as soy sauce or bottled stir-fry sauces. Many vegetables are consumed as part of mixed dishes like sandwiches, pastas with a tomato-based sauce that may have other ingredients that are sources of saturated fats or sodium. For most individuals, following a healthy eating pattern will require an increase in total vegetable intake, and from all vegetables intake including all vegetables content of mixed dishes, or eating less of a main dish to allow for more vegetables as side dishes, keeping these nutrient dense. Beans, peas and lentils is a new name for the vegetable subgroup formerly called legumes. Beans, peas and lentils, which also are known as pulses, include the dried edible seeds of legumes. The food in this vegetable subgroup have not changed. The new name of the subgroup more accurately reflects the category of foods included. Beans include varieties such as kidney beans, pinto beans, black beans, and white beans. Also included are dried peas and lentils. Because beans, peas, and lentils have a similar nutrient profiles to food in both the vegetable group and the protein foods group, they may be thought of as either a vegetable or a protein food when aiming to meet recommended intake. Green peas and green beans are not counted in the beans, peas, and lentils subgroups because The nutrient content of these vegetables is more similar to the vegetables in other subgroups. Green peas which are not dried before consumption are grouped with starchy vegetables, and green beans are in the other vegetables subgroup, which includes onion, lettuce, and cabbage. Foods made from processed soybean are the part of the nuts, seeds, and soy products protein food subgroups. The fruit food groups include whole fruits and 100% fruit juices. Whole fruit includes fresh, canned, frozen, and dried forms. Whole fruits can be eaten in various forms, such as cut, sliced, diced, or cubed. At least half of the recommended amount of fruit should come from whole fruit, rather than 100% juice. When juices are consumed, they should be 100% juice and always pasteurized or 100% juice diluted with water. When selecting canned fruit, choose options that are canned with 100% juice or options lowest in added sugars. About 80% of the population does not meet fruit recommendations. Over 60% of all fruit intake comes from whole forms, fresh, canned, frozen or dried, or 100% juices. Fruit is generally consumed in nutrient-dense forms such as plain bananas, apples, oranges, and grapes. Some fruit is consumed as part of the fruits that may not be nutrient-dense, such as fruit pie or similar desserts. Most people would benefit from increasing their intake of food, mostly as whole fruits in nutrient-dense forms. A wide variety of fruits are available in the marketplace, some years round and others seasonally. Strategies to help achieve this shift include choosing more whole fruits as snacks and including them in meals. Healthy dietary patterns include whole grains and limit the intake of refined grains. At least half of the total grains should be whole grains. Individuals who eat refined grains should choose enriched grains. Individuals who consume all of their grains as whole grains should include some that have been fortified with folic acid. Grain-based foods in nutrient-dense forms limit the additions of added sugar, saturated fat, and sodium. A food is 100% whole grain food if the only grains it contains are whole grains. A 1 ounces equivalent of 100% whole grains has 16 grams of whole grains. The recommendations to consume at least half of total grains as whole grains can be met in a number of ways. Choose 100% whole grain fruits for at least half of all grain consumed. The relative amount of whole grain in the food can be inferred by the placement of the grain in the ingredient list. The whole grain should be the first ingredient or the second ingredient after water. For foods with multiple whole grain ingredients, they should appear near the beginning of the ingredient list. Choose products with at least 50% of the total weight as whole grain ingredients. If a food has at least 8 grams of whole grains per ounces equivalent then half of the grains are whole grain ingredients. Most of the population meet recommendations for total grain intakes, although 98% fall below recommendations for whole grains and 74% exceeds the limit for refined grains. Almost half of all the intakes of refined grains is from mixed dishes such as sandwiches, burgers, pizza, macaroni, and cheese. About 20% of intake of refined grains comes from snacks and sweets. The remaining refined grains are generally eaten as separate food items, such as pancake, cereals, breads, or rice. About 60% of the whole grain intake from individual food items, mostly cereals and crackers, rather than mixed dishes. Grains are generally consumed in forms with higher amounts of sodium and added sugars. Grain-based desserts, many ready-to-eat breakfast cereals are included in this, rather than the nutrient-dense forms. Grains are often consumed as part of mixed dishes, such as pasta dishes and sandwiches, that may have other ingredients that are not in nutrient-dense forms. Shifting from refined whole grain versions of commonly consumed food, such as from white to 100% whole wheat breads and white to brown rice, where culturally appropriate, would increase whole grain intakes and lower refined grain intakes to help meet recommendations. Shifting to more nutrient-dense forms of grains such as ready-to-eat breakfast cereals with less sugar will help meet healthy dietary patterns with careful planning. Limited amounts of salt, butter, or sources of added sugars can be used to make some grain-based foods more palatable while staying within calorie and nutrient limit. But most grains should be eaten in their most nutrient-dense forms. Reducing intakes of cakes, cookies, and other grain desserts will also support reducing refined grain intakes and staying within calorie intake needs. Healthy dietary patterns features dairy, including fat-free and low-fat 1% milk, yogurt and cheese. Individuals who are lactose intolerant can choose low-lactose and lactose-free dairy products. For individuals who choose dairy alternatives, fortified soy beverages and soy yogurt, which are fortified with calcium, vitamin A, and vitamin D, are included as part of the dairy group because they are similar to milk and yogurt based on nutrient composition and in their use in meals. Other products sold as milks but made from plants may contain calcium and be consumed as a source of calcium, but they are not included as part of the dairy group because their overall nutritional content is not similar to dairy milk. And fortified soy beverages. Consuming these beverages does not contribute to meeting the dairy group recommendations. About 90% of the population does not meet dairy recommendations. The percent of the population who drink milk as a beverage on a given day is 65% among young children, 34% in adolescents, and about 20% for adults. Dairy is generally consumed in forms with higher amounts of sodium and saturated fat, and can be a source of added sugars such as flavored milk, ice cream, and sweetened yogurt. Most individuals would benefit by increasing intake of dairy in fat-free or low-fat forms, whether from milk, yogurt and cheese, or from fortified soy beverages or soy yogurt. Strategies to increase the dairy intake include drinking fat-free or low-fat milk or a fortified soy beverages with meals or incorporating unsweetened fat-free or low-fat yogurt into breakfast or snacks. Healthy dietary patterns include a variety of protein foods in nutrient-dense forms. The protein food groups comprises a broad group of foods from both animal and plant sources and include several subgroups: meats, poultry and eggs, nuts, seafood, seeds and soy product. Beans, peas and lentils may be considered a part of the protein food groups as well as vegetable group. Protein also is found in some foods from other food groups such as dairy, meats and poultry vary in fat content and include both fresh and processed form. Most intake of meats and poultry should be from fresh, frozen or canned and in lean forms. A healthy vegetarian dietary patterns can be achieved by incorporating protein foods from plant. Vegetarian dietary pattern is higher in soy products, beans, peas and lentils, nuts and seeds, and whole grains. Inclusion of dairy and eggs make this an example of a lacto-ovo-vegetarian pattern. Meat, poultry, and seafood are not included. Seafood, which includes fish and shellfish, is a protein food subgroup that provides beneficial fatty acid, that is, eicosapentaenoic acid and docosahexaenoic acid. Mercury in the form of methylmercury is found in seafood in varying levels. Methylmercury exposure for women who might become or are pregnant or lactating and young children. Seafood choices higher in EPA and DHA and lower in methylmercury are encouraged. Seafood varieties commonly consumed that are higher in EPA and DHA and lower in methylmercury include salmon, sardines, trout. Intakes of protein foods are close to the target amount. About 90% do not meet the recommendations for seafood and more than half do not meet the recommendations for nuts, seeds and soy products. Slightly less than half, 43% of all protein foods are consumed as a separate food item, such as chicken, egg, a fish, or peanuts. About the same proportion are consumed as part of a mixed dishes 48%, with the largest amount from sandwiches including burgers. Protein foods are generally consumed in forms with higher amount of saturated fat or sodium and often part of mixed dishes that include other ingredients that are not in nutrient-dense form. Shifts are needed within the protein foods to add variety to subgroups intakes, selecting from the seafood subgroup or the beans, peas and lentils subgroup. More often could help meet recommendations while still ensuring adequate protein consumption. Replacing processed or high-fat meats with seafood could help lower intake of saturated fat and sodium, nutrients that are often consumed in excess of recommended limits. Replacing the processed or high-fat meats with beans, peas and lentils would have similar benefit, as well as increasing dietary fiber, a dietary component of public health concern. Oils are important to consider as part of a healthy dietary pattern, as they provide essential fatty acid. Commonly consumed oils include canola, corn oil, olive oil, peanut oil, safflower, soybean, and sunflower oils. Oils also are naturally present in nuts, seeds, seafoods, olives. The fat in some tropical plants such as coconut oil, palm kernel oil, and palm oil are not included in the oil category because they contain a higher percentage of saturated fat than do other oils. Strategies to shift intake include cooking with vegetable oil in place of fats high in saturated fat, including butter, shortening, lard, or coconut oil. Some foods, such as desserts and sweet snacks, that are prepared with oil instead of fats high in saturated fat, are still high in added sugars and are not a nutrient dense food choices. When choosing beverages in a healthy dietary pattern, both the calories and nutrients that they provide are important consideration. Beverages that are calorie free, especially water, or that contribute beneficial nutrients such as fat-free and low-fat milk and 100% juice should be the primary beverages consumed. Coffee, tea, and flavored water are also options, but the most nutrient-dense option for these beverages include little, if any, sweeteners or creams. A healthy dietary pattern limits added sugars to less than 10% of calories per day. Added sugars can help with preservation, contribute to functional attributes such as viscosity, texture, body, color, and browning capability, or help improve the palatability of some nutrient-dense food. The nutrient-dense choices patterns are based on availability in the food supply, include 17 to 50 calories from added sugars or 1.5 to 2% of total calories. Food and beverages high in calories from added sugars should be limited to help achieve healthy dietary patterns within calorie limits. When added sugars in foods and beverages exceed 10% of calories, a healthy dietary pattern within calories limits is very difficult to achieve. Most populations have less than 8% of calories available for added sugars, including the added sugars inherent to a healthy dietary patterns. The limit of added sugars is based on the certain assumptions, which include most calorie level have less than 15% of calories remaining after meeting food group recommendations through nutrient-dense choices. Approximately half of remaining calories are consumed as saturated fat and half consumed as added sugars. Total saturated fat intakes meet the recommendation for less than 10% of total calorie intake. Overall calorie intake does not exceed intake needs to maintain or achieve a healthy weight. Based on the assumptions, an individual who needs 2000 calories per day has less than 7% of calories available for added sugars. Individuals who need 2800 calories per day or less have less than 8% of calories available for added sugars. Individuals who need more than 3000 calories may have a total of 9 to 10% of calories available for added sugars. In this portion of the population that requires high calories intake, an upper limit of 10% of calories from added sugars may be consumed while meeting food group recommendations in nutrient-dense food. The 10% added sugar limit allows for flexibility in food choices over time, but also requires careful planning. Added sugars account on average for most 270 calories or more than 13% of total calories per day. Diets are sugar-sweetened beverages, desserts and sweet snacks, sweetened coffee and tea and candy. These food categories make up more than half of the intake of the added sugars, while contributing very little to food groups recommendation. Individuals have many potential options for reducing the intake of added sugar, including reducing the intake of major sources of added sugar. Strategies include reducing portions, consuming these items less often, and selecting options low in added sugars. For those with a weight loss goal, limiting intake of foods and beverages high in added sugars is a strategy to help reduce the calorie intake. It should be noted that replacing added sugars with low and no calorie sweeteners may reduce calorie intake in the short term and aid in weight management. For those 2 years and older, intake of saturated fat should be limited to less than 10% of calories per day by replacing them with unsaturated fats, particularly polyunsaturated fats. Some saturated fat is inherent in food. Some sources are added, similar to added sugars. Some of the nutrient-dense choices included in the dietary pattern include saturated fat, approximately 5% of total calories inherent to the nutrient-dense food. Dietary patterns are from saturated fat from sources such as lean meat, poultry, and eggs, nuts and seeds, grains and saturated fatty acids in oil. There is little room to include additional saturated fat in a healthy dietary pattern, while staying within the limits for saturated fat and total calories. Current average intakes of saturated fat are 11% of calories. Only 23% of individuals consume amount of saturated fat consistent with the limit of less than 10% of calories. The main sources of saturated fat include sandwiches, burgers, desserts, and sweet snacks. Saturated fat is commonly found in higher amount in high-fat meat, full-fat dairy product, butter, coconut oil, and palm kernel and palm oil. Strategies to lower saturated fat include reducing intakes of dessert and sweet snacks by consuming smaller portion sizes and eating these foods less often. Additional strategies include reading food labels to choose packaged food lower in saturated fats and choosing lower fat forms of food and beverages. When cooking and purchasing meals, select lean meat and lower fat cheese in place of the high fat meats and regular cheese. Or replace them with ingredients with oil, such as nuts, seeds. Cook and purchase the products made with oils higher in polyunsaturated and monounsaturated fat. A note on trans fat and dietary cholesterol recommends that trans fat and dietary cholesterol consumption to be as low as possible without compromising the nutritional adequacy of diet. Dietary patterns are limited in trans fats and low in dietary cholesterol. Cholesterol and a small amount of trans fat occurs naturally in some animal sources food. The major source of artificial trans fat in the food supply are no longer generally recognized as safe. Sodium is an essential nutrient primarily consumed as salt. Healthy eating patterns limit sodium to the chronic disease risk reduction levels, defined by the National Academics 1200 mg per day for ages 1 to 3, 1500 mg per day for ages 4 to 8, 1800 mg per day for ages 9 to 13, and 2300 mg per day for all other age groups. As a food ingredient, sodium is used in multiple ways, including curing meat, baking, as a thickening agent, as a flavor enhancer, as a preservative, or to retain moisture. The nutrient dense choice in the dietary pattern provide approximately 16 to 100% of the age specific for sodium across calorie levels with amounts ranging from about 1000 to 2200 mg. For most calorie levels are at most ages, there is very little room for food choices that are high in sodium. Sodium is found in foods from almost all food categories across the food supply, including mixed dishes such as sandwiches, burger, rice, pasta, and grain dishes. Calorie intake is highly associated with sodium intake because sodium is found in so many foods. Multiple strategies should be implemented to reduce the sodium intake to the recommended limits. Careful choices are needed in all food groups to reduce intake. Strategies to lower sodium intake include cooking at home, more often using the nutrition facts label to choose products with less sodium, reduced sodium or no salt added, and flavoring foods with herbs and spices instead of salt based on personal and cultural food ways. Nutrition facts label on packaged foods and beverages is our tool for making informed and healthy food choices. For first time in more than 20 years, the Food and Drug Administration has updated the nutrition facts label. There are a number of key changes to the label include the serving size information is now in large bold font and has been updated to better reflect the amount that people typically eat and drink. Calories are displayed in larger, bolder font. Some daily values have been updated. The percent daily value shows how much a nutrient in a serving of food contributes to a total daily diet. 5% or less is low, 20% or more is high. Added sugars, vitamin D, and potassium are now listed. Along with the updated design, the nutrition facts label helps support healthy dietary patterns by providing information on nutrients of public health concerns, dietary fiber, vitamin D, calcium, iron, and potassium, and on dietary components to limit, such as added sugars, saturated fats, and sodium. Population generally eat and drink about one third of their calories from food prepared away from home. Usually, these foods provide more calories, saturated fat, and sodium than meals prepared at home to help individuals make informed and healthy decisions. Many food establishments and chain restaurants list calories in foods or beverages on menus or menu boards, and additional nutrition information is available upon request. Everyone has a role to play to support access to healthy foods and beverages in multiple settings nationwide where people live, learn, work, play, and gather. Having access to healthy, safe, and affordable food is crucial for an individual to achieve a healthy dietary patterns. Concerted efforts within communities, businesses, and industries, organizations, government, and other segments of society are needed to support individuals and families in making lifestyle choices that align with the dietary guidelines. Food manufacturers and retail establishments can support in achieving a healthy dietary patterns by providing healthy options in all the places where foods and beverages are purchased. During the past few decades, food products and menus have evolved substantially in response to the consumer demand and public health concerns. Food reformulation and menu and retail modification opportunities include offering more vegetables, fruits, whole grains, low fat, and fat free dairy, and a greater variety of protein foods that are nutrient dense while also reducing sodium and added sugars, reducing saturated fat and replacing it with unsaturated fats, and reducing added refined starches. Portion sizes also can be reduced to help individuals make choices that better fit within their calorie needs. Food manufacturers are encouraged to consider the entire composition of the food or beverages, and not just individual nutrients or ingredients when developing or reformulating products. When developing or modifying menus, establishments can consider the range of offering both within and across food groups and other dietary components to determine whether the healthy options offered reflect the proportions in healthy dietary patterns. In taking these actions, care should be taken to assess any potential unintended consequences so that, as changes are made to better align with the dietary guidelines, undesirable changes are not introduced. A change made to reduce the amount of added sugars in a product should not come at the expense of increasing the amount of saturated fat or sodium. Food access is influenced by diverse factors such as proximity to food retail outlets, the number and types of stores in an area, ability to prepare one's own meals or eat independently, and the availability of personal or public transportation. The underlying socio-economic characteristic of a neighborhood also may influence an individual's ability to access foods to support healthy eating patterns. In a survey, 10.5% of the household were food insecure, at least sometime during the year. Food insecurity occurs when access to nutritionally adequate and safe food is limited or uncertain. Food insecurity can be temporary or persist over time, preventing individuals and families from following a healthy dietary patterns that aligns with the dietary guidelines. The prevalence of food insecurity typically rises during times of economic downturn as households experience greater hardships. Government and non-government nutrition assistance programs help alleviate food insecurity and play an essential role by providing food meals and educational resources so that participants can make healthy food choices within their budget. Everyone has an important role in leading disease prevention efforts within their organizations and communities to make healthy eating and organizational and societal norms. Changes at multiple levels of society are needed, and these changes in combination and over time can have a meaningful effect on the health of current and future generations. The dietary guidelines support healthy weight trajectories at each stage of life, appropriate weight gain during pregnancy and postpartum weight loss, healthy growth and development from infancy through adolescence, weight stability during midlife, and healthy body composition late in life. Meeting dietary guidelines recommendations within calorie need can help prevent excess weight gain at every life stage and support overall good health. Dietary guidelines is developed and written for a professional audience. Its translation into actionable consumer messages and resources is crucial to help individuals, families, and communities achieve healthy dietary patterns. My plate is one example of consumer translation, created to be used in various settings and adaptable to meeting personal preferences, cultural food ways, traditions, and budget needs. My plate is used by professionals across sectors to help people become more aware of and informed about making healthy food and beverages choice over time. Following a healthy dietary pattern from birth through to older adulthood can have a profound impact on a person's lifelong health. The dietary guidelines provide the framework for following such a pattern. Broad and multi-sector collaboration is needed to help people achieve that goal. Action on many fronts is needed to ensure that healthy dietary choices at home, school, work, and play are affordable, accessible norms. A healthy eating routine is important at every stage of life and can have positive effects that add up over time. It's important to eat a variety of food, fruits and vegetables, grains, dairy or fortified soy alternatives, and protein foods when deciding what to eat or drink. Choose options that are full of nutrients. Make every bite count. Think about how the following recommendations can come together over the course of your day or week to help you create a healthy eating routine. My plate focuses on choose the foods and beverages with less added sugars, saturated fat, and sodium. Make half of your plate fruits and vegetables. Make half your grains, whole grains. Vary your protein routine, vary your veggies, and focus on whole fruits. Move to low fat or fat free dairy milk or yogurt, or lactose free dairy or fortified soy versions. Government uses the dietary guidelines as the basis of its food assistance, meal programs, nutrition education efforts, and decisions about national health objectives. For example, the National School Lunch program incorporates the dietary guidelines in menu planning. The Special Supplemental Nutrition Program for Women, Infants, and Children applies the dietary guidelines in its program and educational material. And the Healthy People objectives for the nation include objectives based on the dietary guidelines. The dietary guidelines also provide a critical structure for state and local public health promotion and disease preventive initiatives. It provides foundational evidence-based nutrition guidance for use by individuals and those who serve them in public and private settings, including health professionals, public health and social service agencies, healthcare and educational institutions, researchers, agricultural producers, food and beverages manufacturers, and more. The dietary guidelines has a public health mission, health promotion and disease prevention. Medical and nutrition professionals may use or adapt the dietary guidelines to encourage their patients or clients to follow a healthy dietary pattern. The body of current scientific evidence on diet and health review to inform the dietary guidelines included study participants who represents the population, including healthy individuals and people at risk of diet-related chronic conditions and diseases, such as cardiovascular disease, type 2 diabetes, obesity, and some people who are living with a diet-related chronic illness. Because of this public health orientation, the dietary guidelines is not intended to be a clinical guideline for treating chronic diseases. The dietary guidelines often has served as a reference for federal medical, voluntary, and patient care organizations as they develop clinical nutrition guidance tailored for people living with a specific medical conditions. Chronic diseases result from a complex mix of genetic, biological, behavioral, socio-economic, and environmental factors, and people with these conditions have unique healthcare requirements that require careful oversight by our health professionals. Health professionals can adapt the dietary guidelines to meet the specific needs of their patients with chronic diseases as part of a multifaceted treatment plan.